Also on the Hill this morning is House Majority Leader Steny Hoyer of Maryland. Congressman Hoyer, good morning to you.
Good morning. Good to be with you.
Good to have you this morning. You still need, by most counts, at least 10 votes from your party to get this thing passed. And as we just reported, even after seeing the details of the bill, even after meeting with the president, a lot of Democrats still aren't coming on board. What do you think will change by Sunday to get those votes?
Well, Maggie, what I think is that we have seen yesterday very important information from the Congressional Budget Office, which, as you indicate and Nancy indicated, shows that we are doing exactly what we said we would do, and that is adopting a program which will make health care more affordable for families and small businesses, make insurance companies accountable, and importantly, bring down the deficit over $1.3 trillion over the next 2 decades. All of those items are very important to our members. Democrats, and indeed John McCain said that we needed to make sure that all Americans had access to affordable health care. This bill does that. We think members are going to conclude by Sunday that this is the bill that does what we said we would do, and they're going to pass it.
John McCain, speaking of, was one person out of many who criticized special incentives for states, including the Cornhusker kickback, which has been eliminated. Speaker Pelosi went to great pains yesterday to say that this does have equality for all states now. But there's still extra money in there for hospitals in Tennessee. There's still special spending in as many as 11 other states. What happened to the equality for all states in this bill?
Well, clearly there are provisions in there which take care of special circumstances. But the fact of the matter is, as
why is that?
Speaker Pelosi has said, the Nebraska Cornhusker provision was in fact taken out of this bill because that was clearly just targeted. And what we have done is treat all states equally in terms of federal contribution towards Medicaid payments over the coming years. So I think this bill treats all people and all states equally. Are there special provisions in there which deal with certain situations? There are, but those situations are unique and they're being addressed.
Lastly, I'd like to ask you about a poll that came out this morning that shows that 50% of Americans say that they're less likely to vote for their representative in Congress come November if they vote yes on health care reform. Is your party prepared to lose the majority over this and potentially even more?
No, we don't think we're going to lose the majority. As a matter of fact, polling data recently has shown in the Wall Street Journal and The Economist, not two organs that are known as Democratic organs, but they both say that the majority of the public supports this bill. Furthermore, when you go to the internals, as I call them, the individual specific provisions in this bill, eliminating pre-existing conditions from being a preclusion to getting insurance, making sure that insurance companies can't put lifetime caps or cancel your policies when you get really sick, making sure that annually you can't be capped so you drive families into bankruptcy. When you ask people about that, when you ask them even about the exchanges where you have a transparent marketplace where you can compare prices and benefits through a whole range of insurance companies so you can get the best buy, people say 60%, 70%, 80%. Yes, those are good provisions. So I'm very confident that when this bill is passed and people review what it's going to do for them, their families, small businesses, and the deficit reduction that it's going to bring, I think they're going to say, yes, this is a good policy for our country.
All right, Congressman Steny Hoyer, we will be watching what happens this weekend. Thank you, sir.
Thank you.
A lot happens early on The Early Show, weekday mornings on CBS.